Hi, I'm Dr. Alison Kole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did.
Hello and welcome to another episode of the Sleep is My Waking Passion podcast. I am your host, Dr. Alison Kole, and I am joined today by Dr. Sarah Silverman. She is a PsyD. She is an amazing human. I actually linked up with her just through the connections I've made through my transition from a routine clinical practice, meeting all of these women who were so empowered to go about and treat sleep in their own unique ways. So Dr. Sarah, I'm going to call you that for short because you refer to yourself as that. So call me Dr. Alison. You can just call me Alison. But so Dr. Sarah is a Stanford-trained holistic sleep specialist. This is very special, and you will hear a theme if you listen to enough of my episodes where I speak to a lot of folks from Stanford. And Sarah and I were just discussing what an opportunity and wonderful experience it was for her to be able to train there. There's such good research coming out of that area that I get tickled whenever I can talk to anyone from Stanford or Stanford adjacent. I always learn so much from you guys. She really is an expert at creating a personalized, mindfulness-based approach. Another name for it, if you will, would be cognitive behavioral therapy for insomnia. So she is an expert at basically getting you to be able to sleep well without having to take a pill at night, which we know is actually, all the data suggests that the behavioral modifications we make are far more successful if you're compliant and stick with them than any pill on the planet at this point. So she is the CEO of not one, but two companies. Sarah, you are the founder and CEO of Sleep and Shine, which is a boutique sleep telehealth practice. So you offer personalized and holistic sleep coaching services. And you're also founder and CEO of ZzzHaus, which I love, HOUS, Sleep House, which is an online health consulting agency. She does wellness coaching, consulting services. She has been out and about. She has been my pioneer, the person I look up to for how I should be modeling social media and getting the message out. So without further ado, long intro and well earned, Dr. Sarah Silverman. Yay!
Thank you so much for having me. That was such a lovely introduction. I'm so excited to chat with you.
And I was telling Sarah, and you will notice, listen to her voice. Don't you just want to tell her all your tales of woe and get her to help you sleep better? Swooning. I'm just like, I love listening to your posts. So
thank you.
One of the things that you were so gracious with your time about is for us to discuss how do we maximize our circadian health. So what I wanted to start with, Sarah, is can you just explain to everyone sort of what our circadian rhythm is and why it's important to kind of listen to that aspect of our bodies?
Absolutely. So our circadian rhythm is, well, let me backtrack. Circa means close to a 24-hour day. So direct translation is this 24-hour cycle. And we do have actually a lot of different circadian rhythms. But when you hear about circadian rhythm, I think online and on social media these days, oftentimes it is usually referring to our sleep-wake circadian rhythm. And for the purposes of this chat, I will be referring to our sleep-wake cycle. We have this 24-hour sleep-wake circadian rhythm or sleep-wake cycle that really our body repeats or every day kind of starts over. And some people have a little bit of a longer circadian rhythm, and then longer as in a little bit longer than 24 hours. Some people have a little bit of a shorter circadian rhythm. And the idea is to really sync or entrain your circadian rhythm each morning to help with the process of sleep. And so we'll certainly get into a couple very specific ways to help with what's referred to as circadian regulation or circadian alignment. And ideally, living in alignment with your unique circadian rhythm is so important from a sleep perspective.
And Sarah, you alluded to it, but I'm going to poke the bear a little bit, go a little bit outside the sleep zone, because I love what you said, which is we have multiple sort of circadian rhythms. And when I think of it, I focus on the sleep-wake cycle, but part of that is that a lot of different hormone releases, think testosterone, growth hormone, cortisol, like all sorts of things are sort of dictated by when we sleep. Even how we digest food can matter. So all of our organs are on a sort of body clock, if you will. So when you focus on syncing with your sleep-wake, that's sort of the broader macro system, if you will. It actually helps all the other systems, just because sleep is so foundational, to optimize as well. So then your digestion will be better, and your hormone release, and what's supposed to happen is going to happen because you're optimizing your sleep quality. You're getting enough deep sleep and that sort of thing. Do you align with that? I think that's an important point.
Yes, that's such a great point. And, we all have this master circadian clock in the middle of our brain that regulates not only our sleep-wake cycle, but also our eating, fasting patterns, our rest activity patterns. And so I like to think about that master clock as the conductor of our symphony, our body's symphony, if you will. And the rest of our body and really all of our organs have their own peripheral clocks. So their own clocks that regulate and perform a lot of daily functions. And so we want that master clock, that conductor, to be communicating the right time signals to the rest of the body and all of those other clocks, those peripheral clocks throughout our system. That really is, as you said, it's a way to help with hormone regulation, keeping the time of that consistent, help with meal timing and when we should be getting hungry each day. It really does help to inform all of these other daily circadian rhythms that for a lot of us we don't even really think about, but it's that master clock that's kind of conducting the show. We want a beautiful orchestra sound. We want everything aligned and working together.
So what do you think is the most influential to getting us entrained? Is there one key thing that we should be paying attention to?
In my opinion, it's light and dark and light. So dark and light cycles. So specifically getting bright natural sunlight throughout the day versus blocking artificial blue light. And we can get into more specifics, but blocking artificial blue light ideally after sunset and before bed. So our master clock is always getting these time signals based on how much natural light we get or how much artificial blue light that we get. And not all blue light is bad. I think blue light gets a bad rap, but when we think about sunlight, that's actually blue light. We do need that blue light to help regulate our master clock, which again in turn helps sync up all of the other clocks throughout the body. So light and natural light is always going to be the best option to get in the morning, especially. But really, any light that you get throughout the day gives your brain the right time signals. And that really does help regulate not only our sleep-wake cycle, but again, these other really big rhythms like our eating patterns and rest activity patterns. So light, in my opinion, is the best way to regulate your circadian rhythm, your master clock. And it's also what's referred to as a Zeitgeber, which is a German word for time giver. And there are many different Zeitgebers, but light being the most powerful to help sync the clock. And then followed by, I would say, meal timing. So when we eat also can really shift or regulate our circadian rhythm. So light followed by meal timing, and then followed by activity. So either physical activity, exercise, or actually, believe it or not, social activity can also sync the clock in a number of ways. And so light, meal timing, and activity timing. And it really is all about when you might be getting these Zeitgebers. They're very powerful time cues that help signal to the master clock and really help run the show, if you will, run the body's processes on a daily basis.
I love the points that you're making. And one of the observations that I just thought about now is, as we focus on what we call cognitive behavioral therapy for people who have difficulty sleeping, the key is behavior. And one of the key pieces to, no matter what aspect, cognitive behavioral therapy is a number of things all wrapped into one. And it's a whole other talk unto itself. But one of the keys is having some pattern to your behavior. So in essence, I've never thought about this way, but it makes sense. Your behaviors and, just what's natural for you, who you socialize with, as you mentioned, how you were eating, all those things will influence ultimately your physical activity, which I have become a real stickler about asking about for patients who have difficulty sleeping. Yeah. All of those things really impact your ability to, basically have less insomnia or a better quality of sleep and be able to fall asleep and hopefully stay asleep and wake up feeling refreshed. So it's interesting because when you think about it, it is sort of like insomnia adjacent.
It sure is. Yeah.
So what I wanted to ask you next was, I want to talk about something that I feel I really don't have as easy a time in fixing for folks, which is something called advanced sleep phase disorder. So those are for people that are just like waking up at like 2:00 in the morning and I can't get back to sleep. And sometimes it's a little bit later, but they're always sort of those larks or those like morning type of people. So I wanted to get your opinion because I feel like they're kind of hard to quote fix. And I want to know what you think, but also my observation is sometimes I encourage people, as long as it doesn't seem too ridiculously early, to sort of embrace the fact that they're more morning people, because I feel like you can get a ton of stuff done. So maybe having a readjustment of attitude, depending on when that wake time typically is, tends to be actually my go-to advice. Am I nuts for saying that? I guess that would be my other question to you.
Not at all. Not at all. In fact, I think that gives people permission to really sleep in a schedule that aligns with their biology. And so, I do see quite a lot of folks who have this advanced sleep phase as well as delayed sleep phase. And I think it's really helpful to understand, when we think about these different sleep-wake schedules, in the sleep community, we like to call this your chronotype, which is your unique circadian rhythm and where you naturally feel sleepy and naturally wake up. And ideally, in my opinion, I would love for everyone to be able to sleep in that natural schedule that best aligns with what their brain really wants. So when we think about your unique chronotype, in the sleep community, we also like to think about these different chronotypes from more of an evolutionary perspective. So, if you think back to our ancestor days, and we were outside living in caves, if you will, there was always somebody up at all times of the day versus night in order to protect the tribe. And it didn't really make sense from a survival standpoint for all of us to be asleep at the exact same time. So there is this very big theory that we've evolved to have these different sleep schedules. And maybe, back then it served a different purpose than maybe it does now. But I do find that for a lot of folks, it is a little bit more challenging to say sleep in their natural sleep schedules because of the world that we live in. And there is a lot of pressure to sleep in what might be considered a typical sleep schedule, which for the most part is probably like a 10 p.m. to 6 a.m. or 11 to 7 schedule. So if you're someone who is advanced, where, the way that we kind of classify that is maybe feeling sleepy very early into the night. So like feeling sleepy around 7, 8, 9 p.m., something like that, waking up usually in the, wee hours of the morning, 2, 3, 4, 5 a.m., sometimes, as I think you mentioned, like that 2, 3 a.m. and not being able to fall back asleep. A lot of these folks are awake before the sunrise. And so they naturally just feel like they're early to bed, early to rise. And there's a lot of pressure sometimes to stay up later for these folks, like to be able to go to dinners with friends or to be able to go to a later movie. And it's hard to stay awake in folks who maybe do identify as more of this advanced chronotype or just being a very early bird morning lark. And then on the flip side, there are folks who fall into that delayed category where it's the complete opposite, where they typically don't get sleepy until after 2, 3, 4, 5 a.m. I mean, I've seen as late as 6, 7 a.m. and then might, wake up as their natural wake up time late into the morning, early afternoon. And that just feels so much better to sleep in that schedule. So I absolutely agree with you. I think sometimes if it's possible to actually allow yourself the opportunity to sleep in your natural sleep schedule, because that truly is when everything is going to be aligned from a circadian rhythm standpoint. It's when your sleep-wake timing will be aligned with your meal timing and your exercise timing. And we tend to find this to be the case in both advanced folks and delayed folks. Those who are more early birds, they prefer to work out earlier in the day. They like to eat breakfast typically shortly after waking. That's the complete opposite for night owls, where they do not prefer to work out in the morning. They prefer afternoon or even evening workouts. And then their eating patterns are also delayed. So usually their first meal is when everybody else is eating lunch. And so things are shifted later. And so, yeah, I absolutely think if it's possible, the best case scenario, if you will, best treatment for someone who does feel like they're more of an advanced chronotype is to sleep in that window, because you truly are likely going to get your best quality sleep as everything is going to be aligned.
Out of curiosity, for the folks that are like, listen, that's nice, but you're not the one who's up at 3 a.m. Mm-hmm. I've heard a couple of ways to manage it. One would be, the one that I actually recommend the most is typically like, this sounds crazy, but get your brain, like everything I tell people who can't sleep, like, oh, try to, kind of start to wind down, don't have really bright light in your face, etc. I'm like, oh no, I want you to have some bright light. I think that's what you need to do. I feel like that's the easiest, though I have heard of folks, I think it's just much harder to predict, that say, well, if they're awake, they can take some melatonin. That might also, because of the timing of the melatonin from when they wake up, should be enough so that you're not, further advancing them, that you actually may delay them with taking melatonin. Yeah. I wasn't sure if you use any of these techniques for folks that are struggling, and I wanted to get your opinion on the melatonin. I've heard many different things, so if I can not tell you to take a pill, I usually opt for just using light. But
yes,
have you had any folks where it's worked?
Yes. Well, so melatonin is a little bit tricky because the timing and dosage of melatonin is something that we are kind of predicting. And so there is a little bit of trial and error with that. And in my experience, for folks who have more of an advanced sleep phase, melatonin usually isn't as effective as, say, bright light therapy. And so you're absolutely correct. For folks who want to stay up later, it goes against pretty much all kind of sleep hygiene advice and healthy sleep tips, but you would actually want to get as much blue light in the evening to help delay or shift your bedtime later, if that is a desired goal in being able to fall asleep later. So bright light therapy, if you will, can absolutely help someone who has this advanced chronotype and who does want to stay up later actually be able to delay bedtime. So my first recommendation is usually sleep in your natural window, if possible. Second best option would be bright light, because it is really effective. And usually for folks with advanced sleep phase, I would recommend using an artificial light therapy box, just because that has the intensity and the frequency of light that we want in order to help shift sleep-wake timing. And melatonin, again, is a little bit tricky in terms of timing to figure out. It usually is more effective in my experience with folks who have more of a delayed sleep phase, where we can actually advance their sleep timing. So it would be the opposite. It would actually be advancing their bedtime, shifting their bedtime earlier to get them to sleep earlier to a more desired or typical sleep schedule. But on the other side of that, it would be bright light in the morning for folks who have a delayed sleep phase. So in my experience, light, whether it's natural sunlight or potentially using an artificial light therapy box, that's the most effective way to help either advance or delay circadian timing.
And now a quick break, but don't go anywhere. We'll be right back.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at asktosleepmd.com and start your journey to better sleep with a trusted physician.
If you are liking this podcast, if you're finding it educational, if you are feeling more empowered to go to your doctor with any sleep issues that you might be having to address them, please, please, please lend your support. Make sure that you are liking, following, subscribing. I am available on YouTube. I'm also on Apple, Spotify, or wherever you get your favorite podcasts. The website has launched. So we have asktosleepmd.com to be your free educational resource. We've added many new blog posts filled with juicy information. If you would like to support the podcast, we now have a way for you to donate. This is a labor of love. I truly enjoy what I am doing. It would be inspiring and truly helpful if you wouldn't mind even so much as donating $1 to keep this podcast going, particularly if you really find this free education a good platform for you and a good resource for you. I also have affiliate links for products that I'm a proponent of, such as Quiet Mind. So please check out the website, sign up, and you will get the latest news, the latest blogs, some sleep tips, and just have a great day and keep listening. Okay, guys, sleep well.
And I'm going to be a dork here and just put in a shameless plug for the AYO, these IO glasses. I did, a random post on it, and I've got a link on my website. I'm just being transparent. I have that. The reason I like it is because I have a hard time sitting still, and I'm sure I'm not alone in this. And there may be people that are like not going to want to sit in front of it, like that might bother them. So if you could like walk around and do the dishes while you're wearing these glasses and theoretically getting yourself some exposure. So it's definitely not going to be as intense as a light box, but I think anything you could see if it'll help to delay your ability to go to bed a bit and hopefully get you to sleep in a little bit later. That might get our really early morning birds a little bit extra darkness, which they might like.
Yeah, I'm actually such a huge fan of those glasses because you're right, you can put them on and just kind of go about your evening routine, or for folks where, they're more delayed and we want to get them to an earlier bedtime, it would be wearing those light glasses in the morning. So I think depending on your desired sleep schedule, those light therapy glasses can be a really effective tool to help. And sometimes they're a lot easier to use than a light therapy box, as you said, because you have to be sitting and you have to have the box pretty close to you in order to achieve those effects. And so, yeah, I think it's just more realistic to have a portable, more convenient option.
I just think in this day and age with like the 20 things you do on top of your day job, it's like, do I really just sit here? I'd rather be folding some laundry or doing something that's practical while I'm doing that.
Multitasking.
So you've been alluding to this, and that is the delayed sleep phase. And I have known many, I feel like it's very common actually. I think it's far easier to delay your sleep phase. I meet fewer advanced sleep phase people than I do delayed sleep phase. One of the things that I've noted about these delayed folks is that, to your point, you've seen some really extreme cases, and so have I. And but the thing is, it's funny because they're more common, at least the people I've seen. And even though I think it's harder to treat the advanced folks a little bit because I think, which may just be my own personal bias, the delayed folks, I think there's a lot of discipline that goes into those folks. So in essence, I'm probably a bit misleading in that I actually think they're incredibly tricky, but I feel like maybe it's just intuitive. Like if you do this, this is likely to happen. And to your point, I think it's so easy to remember to take some melatonin like 5 hours before your actual bedtime. And I feel like that will help quite a bit, but also just there's a lot of discipline, and it's you got to keep up with it. It has to be like 7 days a week. A lot of folks naturally just be like, oh, but it's the weekend. I don't really have to do anything. So why can't I be in bed till noon? That kind of thing. So can you talk a bit more about our night owls, if you will?
Yes, absolutely. And you're right. I think it has to become a lifestyle. It has to be a consistent practice. And I think especially more so for folks who do have more of a delayed sleep phase where, if the goal is to shift earlier to a more desired sleep schedule, it does take a lot of consistency and work to maintain that schedule. And one of the main reasons for that is because, when we think about chronotype and we think about your preference for your sleep-wake schedule, it's biological. It is not psychological. And so a lot of people think that, oh yeah, we can just change this. And it's almost like trying to change your heartbeat. It's virtually impossible. And, with that being said, there are certainly ways that we can shift and manage the timing of your schedule. But ultimately, we are fighting biology and what your body actually wants in terms of your sleep-wake timing. So these folks, as far as the delayed sleep phase, you and I can relate to this. I think just by nature of our work, we probably tend to see some of the more severe cases of either advanced or delayed sleep phase. And I do tend to see more folks who have delayed sleep phase just because it's a lot harder to function in our 9-to-5 world. It's hard to hold a day job. It's even hard for teenagers to wake up in time for school because oftentimes there's an intrinsic shift that happens in our sleep-wake timing during adolescence. And so we all have this shift during our teenage years, and then some people end up staying in that shifted window and having more of this delayed schedule. So in my experience, in terms of what's been the most effective approach for helping these folks is to really leverage using a microdose of melatonin. And I'm always cautious when recommending this, but it really is typically effective for these folks where, you would want to ideally take a microdose starting about 5 hours before your desired sleep timing to advance or shift bedtime earlier. And because
when you say microdose, is it like 0.5, 1 milligram?
Yeah,
that's typically what I'll say about 1 milligram.
I prefer even less than that, so either 0.5 or 0.3. And in my experience, I've actually found like the lower the dose, the more effective, which, I think goes against what is recommended. Like if you read the back of most melatonin products, they're often at higher doses and they're often directed to take at bedtime or 30 minutes before bedtime. And we just know that it's not really effective in the way in which we want to shift sleep-wake timing as far as being...
Thank you for pointing that out. I have so many people that tell me, and I'm sure you have, but melatonin doesn't work for me. Like, I'm not going to sleep any soon. I'm like, because you're not taking it at the right time. So it's, great point.
Yeah. And, melatonin, we think about using melatonin in two ways. One being a sedative hypnotic, like a traditional sleeping pill, which really is not going to be effective when we're trying to shift someone's sleep-wake timing because it's all about timing. Melatonin is a way to regulate the timing of our circadian rhythm. So if you take it at the wrong time, it's usually not going to do much. It's kind of like adding water to a pond because your brain has already released your own production of melatonin at that time. So that's the first use. And then the second use of melatonin is what's called a chronobiotic or a circadian phase shifter. And that is what has been found to be most effective for helping folks who do have, say, a delayed sleep phase or circadian rhythm disorder. So it can also be effective for potentially overcoming jet lag, like if you're crossing multiple time zones, or for shift workers. Sometimes it can be effective too. So melatonin is all about timing. And when we're taking exogenous or over-the-counter melatonin, I think it's so important to work with a sleep specialist, because if you just take it at the wrong time, it's probably not going to do much for you. So the timing is crucial. And usually for folks who have a delayed sleep phase, starting about 5 hours before is where I found it to be most effective. But sometimes you have to take it earlier than that. Like I have some folks who take it 8 hours before they want to be asleep.
Wow.
Because they're extremely delayed. So it really is this trial and error experiment, if you will. And that's also kind of the tough part with the circadian rhythm research. We actually really don't have a set protocol as far as how to manage these different schedules. And it is very individualized. It's very nuanced. And I think it just really speaks to the fact that there isn't a one size fits all when it comes to improving sleep.
And, I had heard that at Stanford, they've been looking at delayed, what am I thinking of? Is it DLMO?
Mm-hmm. Dim light melatonin onset. Yeah.
Dim light melatonin onset. Thank you. I had a complete brain fart. I appreciate you. Yeah. So dim light melatonin onset, and there are some tests that you could actually do. Have you ever found that you need to incorporate that type of testing into clinical practice? I have not personally done it, but I wonder if it gives any sort of an edge on getting a better sense of where things are at.
Yes, I personally do use dim low testing in my practice when I feel like it might be appropriate, or when I feel like it might just corroborate my clinical impression. And I don't think it's 100% necessary, but I do think it can be a very useful tool just to really get a sense of when someone's melatonin starts to get released before bed, and then what their melatonin looks like in the morning. So even just a few years ago, this testing wasn't available for clinicians. It wasn't available in the clinic setting. It was really just available for research purposes. So yes, I do think it can be a helpful tool. But on the other side of this, it's really hard to maintain the same conditions, if you will, at home than, how dim low testing is usually conducted in a research setting. And specifically what I mean by that is you have to keep dim light for, ideally the entire day that you're testing. And so the testing that I use is a saliva sample, and it measures your melatonin and also your cortisol levels, because they're kind of like a seesaw in terms of how they influence each other. So we have a sense of when melatonin is peaking and cortisol as well in relation to sleep-wake timing. And so that really does give us a sense of where someone's melatonin starts to get released, and that can help inform when someone should be taking over-the-counter melatonin as far as timing and being able to advance or shift their sleep schedule. So keeping those dim light conditions at home can sometimes be tricky, which can...
I can't imagine.
Yeah, it's really hard to create the conditions. Like, when I tell folks, like, you really don't want to be getting any light that whole day that you're giving your saliva samples for this testing, because that can impact the release of your melatonin production. So while I do think it's a helpful tool, it, maybe isn't as accurate, if you will, when we look at the dim low testing in more of a research setting where those conditions can be controlled.
That is such a great point, and thank you, because I have been curious about this. Like, am I missing something? Should I be doing this more routinely? And it sounds like, for the most part, I have not encountered anybody that I think I really need to be like, oh, I need to cinch this diagnosis to the point where I've got to have them do that. But what you're describing is the fact that it is possible now to do that. That's A. Mm-hmm. But B, while it's possible, it's kind of a pain in the patookus, yes. It sounds like. So you got to be really committed to want to do that.
Yes,
it does sound like you have some patients that have been very challenging. So it's nice to see that you're able to utilize that type of tools for sure.
Part of it too is because I identify as having a delayed sleep phase, and I've done other interviews about my story as well. And so I do have folks who reach out to me because of my own personal experience in trying to manage having a delayed sleep phase that's been lifelong. So the dim-low testing is a really helpful tool, but the diagnosis, I think, is usually made and can be effectively made with just clinical impression.
And you brought up one other thing, which is when you're thinking about your career choices and your life choices, I think it's important to keep in mind something that we don't often do, which is think about what kind of person you are, what kind of schedule you like to keep. I mean, I have to say, in thinking about it, my husband, he was at one time married to someone who actually had quite a delayed sleep phase. Mm-hmm. And they never could seem to get aligned with certain things. And I do think it's really hard sometimes. I'm not saying that if you guys worked it out and there's a yin and a yang going on, I am not here to make commentary on that, okay, guys? But I think it's an interesting conundrum when if you're the type of person who emotionally wants someone who kind of can wake up with you, have that morning cup of coffee with you, if you're that type of person, and it's hard if that you just still got to do that coffee by yourself because your partner's not going to be up for another 3 hours or so, or vice versa, because you may be like, hey, I want to go stay up and watch that movie, and then your partner's like, man, I got to go to bed, bye. Yeah. And so that can be really tricky as well, or just timing of things, or when you like to eat together, mm-hmm. and managing just household things can be really tricky. I think what you also mentioned that's really important is if you can stay in alignment, great. And so the one, I guess, benefit, if you will, is depending on the type of work that you like to do. If you're somebody who is an ER physician, for example, you could pick a shift that's more afternoon or evening potentially. Mm-hmm. If you're more of a delayed sleep phase, or vice versa, if you're okay with coming in early, surgery might be a great selection. I'm being a nerd and picking all these medical things, but it applies to anything. Police officers are a classic example. I have so many that because their shifts constantly, oftentimes when they're younger, have to change all the time. That's often they're like, listen, I'm great on this shift, and then I really struggle with this other shift. Same thing with firefighters and other folks that have more shift work-based approaches. Mm-hmm. I think it brings up an important teaching point here for anybody who's listening, which is, restructuring society, be more kind to people of different circadian patterns makes a ton of sense to me. It really mm-hmm. does. And I think it's something that's often overlooked is the power that we have if we can change culture.
Yes, I completely agree with you. And I think in an ideal world, I would love that as well, where we're all working in rules that are in alignment with our internal clock, our biology, because we would all just be a much happier place. I think for a lot of us too, we know what type of work schedule feels best for us. And when we work in those schedules, we feel more productive. We feel more alert. We have more mental clarity. I feel like we can get more done, and also with a good mood at the same time. And so I think if we all were able to work in a schedule that aligns, things would be so much easier. But we can dream.
We can dream, but we can advocate for later school start times for our teens, yes. People. That is one of the things I'm going to be pestering the ASM about as I move forward in the ASM Advocacy Committee. I just cannot wait to keep poking the bear about that one. I have no idea how to change it locally. I'm going to have to figure it out, but yeah. So Dr. Sarah, thank you so much for your time. I can't wait to speak with you again off camera. You're just such a delight and a treat. And thank you so much for sharing your wisdom on circadian health.
Absolutely. Thank you so much for having me. This was so fun.
Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.